Yeah, thanks, Kylie. I'm Desiree Jones-Smith. I'm currently the Senior Manager for Campus Partnerships at the University of Missouri St. Louis. I work with the Community Innovation and Action Center, and I will be co-facilitator alongside Adriano today. I want to thank everyone for joining us. We are so excited to have so many great voices on the call today, as well as so many great voices in our participant list as well. And there will be an opportunity for everyone to be heard. We really jumped at the chance to bring this group together because we know that the work of the university is objectively strengthened when the community is brought together and brought to the work of the university. Adding community voice to in very meaningful and mutually beneficial and equitable ways is a key goal of CIAC's work. The Connect 4 series, which this conversation is a part of, is one manifestation of that goal. I encourage you, if you have not already, to visit our website and to join our mailing list to receive more invites to meetings like this and conversations like this. Just a bit of housekeeping. We, as of right now, have over 60 participants on the call. So you will be muted until the Q&A portion of the conversation. Facilitate or asked to make a comment or ask a question. Feel free to put your comments or questions inside of the Q&A box so that our moderators can begin going through that even now. But there will be a time in about a half an hour to 40 minutes for you to ask questions or provide comments, either with your own voice or for us to read that for you. But we would on a few platforms. Like to ask a question, but you don't feel comfortable asking.
Desiree, this is Kylie, and the video is pausing, so maybe turn your video off, and if that doesn't work, we will transition to another moderator.
Oh. Hi, Desiree.
Hi.
You still good?
I think that I am. I don't know if
Okay.
I've seen. Awesome. All right, guys. And now I will turn it over to our panelists to introduce themselves. Sheila, would you like to start us off?
Sure. Good morning, everyone. My name is Sheila Grigsby. I'm an Associate Dean of the Community Engagement and an Assistant Professor at the University of Missouri St. Louis in the College of Nursing. My educational and professional background are in both community health and public health. I'm a doctorally prepared nurse scholar whose research and teaching both focuses on addressing health disparities and assisting communities to develop their voice to address health issues in their own communities. My professional background includes over 10 years of experience in working with the Department of Health as a manager in HIV/AIDS surveillance, as well as working with teenage pregnancy prevention as a parish nurse, as well as a director of a not-for-profit working with faith communities to address health disparities, including STD, HIV, and AIDS.
Alicia?
Hello, everyone. My name is Alicia Hernandez. I am the Eastern Missouri organizer for the ACLU of Missouri, where we work to protect civil liberties, and that's through advocacy, organizing, and public education. We are also a coalition member of the Missouri Immigration Policy Coalition, where we work on statewide policy initiatives. I'm also the co-creator of the St. Louis ICE Rapid Response Line. This is a response hotline that supports community members who may be concerned about immigration enforcement in their neighborhoods. I've also been part of an organizing team in the St. Louis area. It's called STL COVID-19 Mutual Aid Work. We have been offering direct resources like groceries and supplies, as well as financial solidarity for people and families who have been affected by COVID-19. As of yesterday, we've redistributed over a little over $40,000. Thank you.
Wow.
Sarah.
Hi, everybody. My name is Sarah John. I'm the director of the St. Louis Interfaith Committee on Latin America. We say IFCLA because otherwise that's a mouthful. I've been with the organization for a little over 15 years. The organization has been in St. Louis for not quite 40 years, doing education, organizing, and accompaniment. One of the largest volunteer programs that we have, and the ways that we've sort of stepped into some of this work in the last 3 years, is through development of the ICE accompaniment program, which trains teams of volunteers to accompany immigrants to check-ins with ICE and other immigration authorities. So I think I will pause there and look forward to talking more soon.
I think alphabetically, I'm probably up next. Hi, I'm Katie Hoffman. My chief role right now is mom to a 6-month-old and a 4-year-old who will probably be making appearances during this event. But my day job typically is the director of Ready by 21 St. Louis, which is a child well-being focused collective impact initiative in St. Louis City, St. Louis County, and St. Charles County. We work with a number of partnerships who touch children's issues from early childhood all the way through to young adulthood and career. So glad to be on the call today. Lots of policy and systems implications. Can you wave? In my volunteer time, I am also a school board member in Maplewood, Richmond Heights, which is in St. Louis County. So have lots of thoughts and opportunities to discuss systems related to education.
Great. How about we go to Chris next? Chris Prenner, sorry.
No worries. Trying to be mindful, there's 2 Chris's, always dangerous. Yeah. My name is Chris Prenner. I am an assistant professor of sociology at St. Louis University. I also have a background in pre-hospital medicine, both as a provider and a researcher, looking at ambulance work in urban settings particularly. At SLU, I teach and do research on health disparities, particularly place-based health disparities in neighborhoods and how people interact with first responder systems. I will leave it there and talk more about some of my interests in a few minutes.
Good morning, and I'm the second Chris on this panel here today. My name is Chris Sullivan. I'm the Director of Health, Counseling, and Disability Access Services here at the University of Missouri St. Louis. So my unit is responsible primarily for providing mental health, physical health services to UMSL students, and then also we kind of coordinate our disability access, so providing academic accommodations to students as well. Lately, another additional duty that has been passed on is I've been working with a small group of people in our unified command structure at the university here, so kind of from an emergency management perspective. So that's been a lot of the work we've been doing, is also kind of just preparing the campus as well. So I'm assuming that will probably come up as a part of what we all talk about here today, just how we're adapting kind of our metropolitan public university in the area to deal with the difficulties that have arisen through the COVID-19 crisis.
Perfect, everybody. My name is Bernea Lester. I work with the Community Innovation and Action Center. I'm just really here to help and back up for Desiree, me and her team. I'm the Learning and Evaluation Manager. One of our guests could not make it. Pat, he had to cancel last minute. His name is Cordero Pat Patrick, AVP of Community Investment St. Louis Economic Development Partnership. He was scheduled to be here. However, as many of us know, things do come up, challenges of this pandemic, they do rise. And so he wanted to share his deepest apologies as he cannot be here. He wanted you to know that SLEDP is working hard to ensure those that are hit hardest have the technical assistance needed to take advantage of the programs and keep their doors open. They are focusing a lot of attention on North St. Louis County, South St. Louis County, and North St. Louis City, and assisting many regions, local governments. If you want to learn more about SLEDP and Pat's work, we will include a link in his to his website and follow-up communications as well. Perfect. So next, just to kind of get everything started, we're going to have each panelist really kind of give us their opening statement about our COVID-19 in the St. Louis region and anything else they want to share. We're going to start with Dr. Sheila Grigsby. So you go ahead, Dr. Sheila.
Okay, thank you. At the College of Nursing, we've been able to empty our lab space and share our PPE with local hospitals in response to the needs of the community. We've also, with this pandemic, we've been looking for ways for our students and faculty to respond. We've worked with St. Louis County Health Department to assist with contact tracing, and we've also had a group of faculty and students who have started working with Amazon to provide temperature checks to drivers and factory workers. In making observations of our community, it's been very hard to keep up as well as understand the many changing facts that are being shared on the news cycles. It's clear that depending upon which news cycle you listen to will determine your reaction or lack of reaction to what's been going on. I've been made to feel more comfortable with the local health department responses to shelter-in orders, which came weeks prior to the state's order in Missouri. And some of the system level impacts that I see are the disproportionate representation of people of color. As we learn more about the disease, we see that African Americans present with this disease very differently. So many of the questions that they were, that you're asked to respond to, they were not given the appropriate answers. So they weren't allowed to even take the test for a delayed period of time. So these slow and delayed responses have exposed a very flawed healthcare system. Missouri's decision not to expand Medicaid continues to greatly impact individuals and families that do not have health coverage. And the messages from the media to the public have been directing individuals to go to the emergency room if they are experiencing symptoms. The directions have also been to call your doctor. But I'd like to ask the question, what if you don't have what if these two options are not available to you? What is the third option? What if you have no doctor to call? If we need to be presenting families with other options to seek care, and I just don't think that that's really been clearly discussed when we talk about health messages and health messaging. The delayed testing sites in North St. Louis City and St. Louis County are just completely unacceptable. Thankfully, federally qualified health centers like Affinia and Care St. Louis have opened sites, and now People's Health Center are providing testing. But the messaging is still not clear about what to do if you're not insured or if you're not a member of these facilities for testing. And the one thing that continues to really bother me and is the fact that family members are not allowed to be with their loved ones. There will be a long-term impact from this that we have not even started to think about. We'll begin to see a large burnout on the nursing profession who are having to take care of their patients, go home and take care of their families, and still maintain status quo. As we continue with these stressors, we're going to see greater problems arise like compassion fatigue and other problems that will impact our healthcare system for many years to come. So I'm going to stop here.
Thank you so much, Dr. Sheila. Next, Alicia, just the same thing, kind of just want to know from your vantage point what you might see as system level impacts on constituents as far as just any observations, good or bad, that you also see as well.
Absolutely. So currently at the ACLU of Missouri, we are working to decrease the number of people who are incarcerated and detained. We've been doing this by pushing sheriffs, prosecuting attorneys, and elected officials to grant release consideration for people who are being held on cash bail, elderly, immunocompromised, pregnant, or anyone else who anyone else who poses a minimal risk to the community. So we have been seeing some jail releases of incarcerated people, but it has been challenging to get exact numbers from jails in regards to release and ICE holds. We have also seen prosecuting attorneys in our St. Louis area who have been receptive to special releases. However, there's always more room for more collaboration and a higher number of releases. So we are working on that in the St. Louis area. One thing that we have seen that is hopeful is that sort of in this time of COVID, there is an amplified sort of sense of urgency from the community regarding people who are incarcerated. Why are they incarcerated? How are these systems failing even before COVID-19 happened? So a lot of advocacy groups are sort of talking about how to meet the immediate needs of people and then build off of that to continue a lot of the work that we have been doing to end things like mass incarceration, detention, and deportation. I think some of you may know that on Monday, the Trump administration extended border restrictions that allows border agents to expel all migrants apprehended without the fear of screening required under the US. Also this morning, we saw some reports that the Trump administration is scrambling to finalize an executive order after there was a late night tweet from Trump that he would temporarily suspend immigration in the US. The ACLU is also sort of scrambling to respond to this. From how we've moved historically, we'll probably wait for the executive order before we take any concrete actions to see what's in that. A little bit more on immigration. On March 18th, US Immigration and Customs Enforcement, ICE, they did announce some policy changes in regards to COVID-19. They announced that they would halt the number of arrests among undocumented immigrants, but only for those who do not pose an imminent threat. In the statement, it went on to explain that ICE would halt raids near healthcare facilities, including hospitals, doctors' offices, urgent care facilities, with the caveat of except in the most extraordinary circumstances. So with the St. Louis ICE Rapid Response Line, we did continue to get a couple of calls. There was some ICE activity in a community. There was sort of a stakeout. People were confused and concerned. And so in response to that, the St. Louis ICE Rapid Response Line held a bilingual in English and Spanish Facebook Live video, which I'll link a little later, where we talked to folks about what are the policy changes that ICE is committed to in regards to COVID, how to identify ICE in your community, how to record safely and ethically if you're going to, and a little bit more information on the hotline. And then we also gave information on the St. Louis COVID-19 mutual aid work. And so we've also been working on that. As we've seen, this is a global pandemic and impending recession. The news is overwhelming, and some of these systems in place are failing to respond with limited resources and even financial support. A lot of us have seen that some families don't even qualify for governmental aid or assistance because of grant and funding restrictions through nonprofits or because of certain status or needed documents. And so what this mutual aid is, it's rather than giving to an organization, a group of organizers, we wanted to build a structure that allows us to practice financial solidarity. So that is direct giving to those who need it. It's based on the idea that people know what they need best and that we are showing up for that. Our primary guiding value is that the distribution of funds are equity, trust, and urgency. So all funds are received and distributed out of within a week based on people's needs, however they express to us. We have also been working on helping with delivering groceries, supplies, as well as helping folks navigate the healthcare system. There have been a lot of work to bring language access, language justice to some of the resources that are out there, but it didn't quite happen fast enough. So a lot of people were trying to navigate these systems with limited language access. So the line also stepped up to sort of help be interpreters on the phone call for people who needed it. So that's sort of what I've been seeing and working on in my capacity.
That's fantastic, Alicia. Kind of, yeah, the same question for you, Sarah. Just your purview on kind of the impact, the system level impacts in the community, you know, good or bad.
Thank you. I have the immense pleasure personally and organizationally to work and partner with Alicia on a lot of things. So I'll maybe just try to supplement or add some some additional information to the points that she made. I think one of the pieces that ICE announced, I think it was also in the March 18th era of their wave of announcements, is that they suspended until further notice the check-ins that I had mentioned previously. And so I just want to go into that maybe a little bit and talk about what that looks like. So for folks that maybe I think in common language we would call asylum seekers, people that appeared at the border in the past couple years and are trying to seek asylum here, fleeing something, specifically in Latin America would be the population that I'm talking about. And when they get processed at the border, they often don't actually seek asylum. So what basically happens is that the government says, sure, you can come in and we are going to start removal proceedings, deportation proceedings right then, and you will have the right to see a judge in most circumstances. I'm making sweeping generalizations, right? And you can come in so that we can deport you, and then you will have 1 year within that time period to file a defense, which could be seeking asylum. So I think what happens then is that we have seen a huge increase in the number of folks here in St. Louis that are predominantly women and families, though not exclusively, that are trying to seek asylum and figure out that process. And during that time, they're placed on 24-hour, 7-day-a-week electronic surveillance. So the vast majority of these folks are placed in what's called the ISAP program, the Intensive Supervision Appearance Program. And without going into all of that, just think money, right? So ICE gets a bunch of money, they subcontract it out, and we figured out ways as the country to profit off of incarceration of people of color, which I'm sure comes as no surprise to anyone in this space. What happened is that those check-ins were then suspended. And so what that meant was, how are folks knowing? How do the folks that are on ankle monitors know whether or not they have to go in? There continues to be significant misinformation about whether or not the immigration courts are closed. And as recent as last week, we had these subcontracted ISAP employees calling folks, immigrants who are on ankle monitors, who are restricted to their homes now, like the rest of us, saying, you have court next week, do you have an attorney? And so that's blatant lies. Those courts are continued in St. Louis. And so that feels really concerning. I think overall, what I would observe at sort of a systems level is sort of an exacerbation or maybe even a spotlight on what has been pre-existing systemic struggles in these communities. As Alicia mentioned, the economic impacts and support for many of these folks. So it's not just undocumented individuals, but it's also mixed status families, which is a huge reality in Missouri. So I'm sure some of you have seen that for a lot of the federal programs, the CARES Act, any of those stimulus checks, there has to be someone in the family that has a social security number who can apply. The trick is that if not everyone in the household does, then no one is eligible. So even in family situations where maybe one parent is undocumented and everyone else in the family is documented, they are not eligible. So part of the response has been, how do we figure out how to support undocumented folks and mixed status families in a sort of direct economic moment when they are also folks who are forced to choose, do I take away my entire family's income by not going to work and obeying by public health recommendations, or do I put my health and the health of, quite frankly, all of our community at risk so that I can put food on the table? And those are choices that we shouldn't be forcing our community into. So I think I'll stop there and look forward to answering some more questions as we go.
Thank you so much for sharing that. It just kind of shows you what this impact looks like from a very micro level right here in our own region. I appreciate your input on that. We're going to move that next question right to Katie. I would love to hear your perspective on the system.
Thanks, Brunea. So most folks who are familiar with Ready by 21 have seen a graphic that we use to talk about child well-being. And unfortunately, there is no child well-being system in our country or our community, but we also often talk about an insulated pipeline, that the core of that pipeline really is the education system in our community. Education for young children, education in the K-12 system, and education for training and career readiness for young adults. And that system, or those systems, are really the core of child well-being supports that our community has and our country has. And unfortunately, each of those education systems is really under a lot of stress in the current pandemic situation. Starting with our youngest children, really early childhood is a very fragmented system, if we can even call it a system right now, unfortunately. Early childhood programming is provided by a lot of different entities, from women who own small businesses out of their homes, to large nonprofit centers, or church-based or school-based programs. All of those programs obviously are struggling right now. Many are shut or at least shutting down their locations, but many are continuing to try and provide both educational and basic needs supports to families around the community. And those folks are governed by a very complicated set of regulations from the state and local level. So many are struggling to understand, how does the county's shelter-in-place order impact the state's shelter-in-place orders, and the interplay of those things. Funding is certainly a huge challenge right now, because many of the supports that early childhood programs receive are state and federal funding that is dependent on attendance. And obviously attendance right now is seriously limited, if not suspended indefinitely. In the K-12 space, fortunately, we've had a lot of unifying action in our region, at least around school closures. The region really trying to be speaking with one voice, despite the fact that we have 30 plus school districts and charter schools in our region. And have really seen school districts try to quickly mobilize to provide basic needs for the children who typically attend school, while also trying to create some sense of routine and normalcy around the education activities. I think one of the previous panelists talked about this pandemic exacerbating some of the inequities in our community already. I think just the very wide breadth of ways that school districts are handling online education right now, and how they're even able to equip their teachers and their students with the tools that they need to continue learning, is telling of just the racial disparities in our community, the financial disparities in our community, and just how we've undervalued and underinvested in a number of communities in the region. There is some good news, I think, there, in that there are some more regional entities. I think the 9 network of public media being one of those entities that's really trying to use their public media platform as another opportunity to disseminate learning more broadly. And I think in the coming weeks, we'll be seeing more of their work to partner with school districts around the region and make sure that there are learning activities for some of our younger students. And then finally, in the career readiness space, I think we want to make sure that young people are really on a trajectory to be self-sustaining, productive citizens. And there's a lot of questions right now about what obviously the economy is going to look like, what sort of training opportunities and entry-level positions may be open for young people 16 to 24. Obviously, as the economy contracts, those folks are probably most at risk of not being hired, even for kind of those traditional minimum wage or low skill jobs that teenagers and early 20-somethings often start their careers with. And so some real concerns there. I think there is some real creative thinking happening right now about how do we continue to mentor and support young people to develop career readiness skills and actual hard skills too around specific jobs like healthcare or IT that are obviously experiencing some real need right now. And so I think there's some opportunities for just leaning into this new reality and setting up new structures that benefit us in the long term as well.
Thank you so much. And I'm going to just shoot that question right to Dr. Printer, and then Dr. Sullivan, you just go right after him.
Awesome. Thanks, Bernie. I appreciate it. Like I said earlier, I have an interest in place-based health disparities and in emergency medical services. And, similar to Dr. Grigsby's points about the impact this is going to have on nurses, one of the big kind of systems level impacts that I'm concerned about is the impact this has on EMS providers in particular, who as a group have lower wages and more difficult working conditions than a lot of other healthcare providers, and who really have not been trained or prepared to operate long-term with this level of infectious illness out in the community. And really, when you go into people's houses to provide care, when you transport them, you don't have the ability to distance yourself from patients like healthcare providers and hospitals do. And have access to the same kind of quantity of PPE. And so that's one area where I worry both about the immediate impact of infection, but also the long-term question of burnout among EMS providers, which is already a big issue, particularly in the city of St. Louis, where we have a shortage of paramedics, in part due to the level of gun violence that they regularly treat in our community. So that's one systems level concern I have. The second systems level concern is with our ability to share and communicate data, particularly across counties. This is something where, while I'm happy that the city and the county in St. Louis in particular have been sharing, if belatedly, data on racial disparities, for example, it's clear that the communication systems we have and the ability to get that information out are weak. And more generally, getting that data up to the state has been a continual pain point. And so in addition to my background in EMS, I sort of specialize in mapping data and producing data visualizations. And it's a very tricky landscape in terms of watching the progress of this pandemic, because our public health surveillance systems in the state have not sort of been adequately prepared to deal with such a long-running and fast-moving public health crises. The third systems level impact that I worry about, like others have already expressed, are the exacerbation of longstanding health disparities in the St. Louis area. We've got sort of this twin set of crises where we have a public health emergency that we're dealing with, and then a economic emergency that we're dealing with. And I think both of these are going to work against historically marginalized communities in St. Louis, both in terms of setting them up for potentially higher burdens of illness, which is what we're seeing. So from the data we have in the city and the county, African Americans are experiencing about 3.5 times as many reported positive cases as white residents in St. Louis. This is a reflection of these more deep-seated health disparities that we're experiencing. And then as we go through this and end what's hopefully a shorter period of the public health emergency, start to face the longer-term economic impacts, I worry about both the burden of surviving COVID for those who are infected, what that means for their long-term health and their long-term ability to work. And then even for those who aren't directly impacted by the illness, the long-term ability to access employment, which is already an issue in the St. Louis area, being exacerbated by a contracting economy. So those are the kind of major systems level impacts I've observed. The one thing I wanted to share in terms of entry points, I've also done some consulting with Prepare STL to help their outreach work, and I'll share both Prepare STL's website and my own mapping websites in the chat there. Prepare STL is a collaborative effort between the Missouri Health Foundation for Health and our regional health departments. While I can't speak for them directly, one bright spot is that I think early on, our regional leadership recognized the potential for health disparities and for particularly difficult time reaching traditionally hard to reach groups. And so there has been active health outreach that I've had the privilege of supporting with some mapping work. And so that is one positive, that at least there is some recognition that there are communities that need to be reached and we need to plan for and actively try to reach them. So I will leave it there, but I'm happy to talk about both health disparities and some of the data issues that this has highlighted when we get to questions.
Okay, and then I wanted to bring up I think I come at it from a little bit different perspective here, again, working through this kind of clinic that we have operating here at the campus with it. And I think it's really kind of important to kind of identify that, we are the public urban university here in the St. Louis area with it. And I think it really has kind of identified and drawn out many of the challenges and difficulties that are widespread in our community in general. So I think it's important to acknowledge that, the students that we have are representative of St. Louis. I mean, the vast majority of the students that we have, I want to say somewhere in the 85 to 90% of the students at UMSL are from the St. Louis metropolitan area with it. Then I think that, many of the challenges we've had are, representative of the challenges that we're experiencing in the community right now. So as the university moved to this remote learning, kind of shifting away from in-person classes toward this remote learning environment, because we couldn't have students on campus in groups for many of the public health concerns with it, that it really drew out kind of the difficulties with making that rapid transition with it. There was the assumption that so many of the university services were based on in-person services. And, when you move into the remote learning, all the things about who has internet access, who has technology capacities, who has, things like internet access, things like this, really quickly became apparent on how able we were as a university to kind of continue moving forward with providing education. And we are the major educator here for higher education in the St. Louis area with it. So I think that was at the university level. And I think on a closer level for us was just continuing to provide services for physical and mental health. We haven't spoken much about mental health consequences of this, but we are going to be dealing with the mental health consequences of this crisis for many, many, many years. So we already had this enormous systemic trauma that has been happening to many groups and peoples in the area with it. The difficulties that have emerged from the increased anxiety, the fear, the consequences of illnesses, and and the economic consequences. It's I'm a counselor, so this is going to be more what I'm going to be focusing on. But it's unimaginable what the consequences are going to be. Just the ongoing difficulties that are associated with mental health results from this with it. So from the mental health aspect with it, how do you provide services to students, for our psychologists, counselors, social workers with it? And then from our health services perspective, as Dr. Grigsby was talking about, testing. We had students that were sick and we didn't know how to get them tested with it. And we have collaborating physicians that we're working with that are in St. Louis County. They didn't know how to get people tested. And the initial story was, well, students need to go to the emergency room to get tested. The test is free, but the emergency room charges are not. So that's I'll say ridiculous. How about that? It just doesn't make sense with it. So we still continue. So even if you do have access to the test, it's at what cost and what burden. And I like to think that many of those issues have been addressed and changed a little bit, but I don't think it's significantly better at this point. So and then, you know, adding on to that, the technological aspect of it, the students, we have a lot of students on campus that have disabilities. You know, within one aspect of our unit is assisting those students with disabilities to have equal access to the classroom environment, educational opportunities with it. You know, we have as an institution you know, an obligation to make those opportunities available with it, but the changes happen much faster than we were able to provide kind of the framework and the structure and the support for that. So it's really, again, as we've looking at this, it's the most vulnerable and the most under-resourced people that have really borne the brunt of this. So, you know, even as we're attempting to deal with these difficulties, people that have mental health challenges as a result of trauma, as you know, ongoing systemic oppression, things like this, students with disabilities with it, it's just been an enormous challenge with it, you know, all the kind of the things with it. So, you know, I think there's the benefit to that is that, again, I don't think that we will ever come out of this and imagine that, you know, we are castles or independent of ourselves. It is so clear how interconnected we are with all of this, that, you know, the fact that we have support and resources, we can't imagine that we can only assist part of the population, part of our groups, without taking in that we're all in this together with it. We need to create stronger fabrics, social fabrics and structures to provide support and assistance to benefit to everybody without regard for, you know, economic opportunities, immigration status, you know, disability status, things like this. That it's very important for us to kind of be looking at this societally and say we are responsible for each other, and that there's no way that we can imagine that we're going to be able to get through this without recognizing that we need to be doing that together with it. So, you know, again, I keep going here with the consequences of all this, but I think the important piece of this is that we really need to kind of reevaluate how we're operating as a society, and imagining that some people have greater responsibilities for dealing with this than, you know, so marginalized people need to be looking out for marginalized people with it. That's not how this can go. This is not how this is going to be able to function effectively. It's clear that, you know, all aspects of society and the people that are bearing the brunt of this are, again, the under-resourced with it. We need to change that in society with it. And, you know, I'm hoping that part of our political and public discourse can reframe this and say, you know, we can't imagine that this is only a part of society that needs to be looking at this. So, again, thank you for the opportunity to talk with it. And I know I come at this from a little bit different perspective, and I hope we can kind of contribute to that conversation as we're moving forward with this.
So again, I'm just encouraged by the group of folks that we have to sort of lead the conversation or begin the conversation today. And I appreciate, Chris, for us to be able to end on this idea of mutuality and common mutual aid and support for each other. We have our panelists, whom are esteemed, and we're really glad to have here. We also have experts in our audience, and we want to be sure, right now we're going to take some prepared questions among the facilitators with our panelists, but there is a Q&A functionality on the webinar, and we really would value if members and participants of the webinar are actively putting in their questions or comments or observations. This is not a lecture, this is a two-way conversation, so feel free to begin adding those ideas and comments and questions into the chat function right now, or the Q&A function, and we will be sure to be engaging with those as well. But I'd like to shift gears into a few of the prepared questions that we had for the panelists. And some of this we've sort of touched on in opening statements, but I'd love to allow us just a little bit more time to think about this. So, you know, we've heard about the doctors and nurses who need PPE. We've heard to some extent about the number of essential workers who are regularly being put in harm's way to sustain our access to necessary and sometimes unnecessary goods and services. But we're beginning to ask some of the proper questions around race and equity and access to adequate treatment. But who is suffering in silence? What population is facing a particular danger as we think about this pandemic response, but has not quite gotten the attention necessary to begin assisting that group? So what's missing from our our discourse, our conversation about the impacted communities here?
I'll start, and I'll just say that I think we really haven't touched much on the homeless population, nor have we talked about the elderly.
Thanks for that. Yeah.
We've talked about people without health insurance, but people that have insurance but are not covered for this type of event is someone I think are groups of people that are really going to be left out. Dr. Sullivan talked about the fact that you have coverage to go and get the test, but you don't have coverage for the ER visit, the hospitalization that may occur after being diagnosed. We've left a lot of people out of the puzzle, and that we just don't have a voice right now. And I think we can't forget them. We can't.
So I'm hearing you say that we are forgetting the homeless population. We're forgetting the underinsured. We're forgetting some of the loopholes in some of the responses that are allowing folks to sort of sift through the cracks. Any other populations that we might be forgetting or missing in this sort of community-wide discourse?
I think there have been a few opportunities to lift up some of the folks who are essential in education, but aren't always thought about when we think about schools. So obviously the food service workers and the bus drivers and the custodians who have been putting themselves at risk over the last 5 weeks or longer, I think are doing really essential work. I mean, I think hopefully one of the structural questions that we continue to ask and think about is why is it a school's responsibility to make sure our children have their basic needs met? And thank goodness that those folks are continuing to go to work every day and to ensure that our children are having their needs met. I mean, I think in addition, some of the folks who are working in pantries and other basic needs nonprofit communities are really essential folks that I think some of the decision makers and some of the folks who hold power think that, oh, well, those people are just people who do things out of the goodness of their heart. So of course they're going to continue to do this work, and it needs to be supported. It needs to be paid for. It needs to be managed safely and make sure those folks have protection as well.
And I'm going to say a little bit more about mental health concerns with it, because so much of our mental health treatment models are based in in-person services. So people that have had previous difficulties with mental illness with it, there's no possibility of looking at even substance abuse problem. Groups are not available. There's no AA meetings going on right now. There are no NA meetings going on in person with it. It's also important to recognize we have this absolute epidemic of domestic violence difficulties that are coming on right now. So staying at home is not is devastating for people, where home is maybe the most dangerous place in their lives right now. So there's so many things, and disabilities with it, again, the disadvantaged populations in general with it, but there are just so many ramifications for this with it. So just to include that as well.
Can I add one more?
One of our participants, Abby, is asking us to maybe rethink the term vulnerable and thinking about how we might think about engaging with full members of our community and maybe not marginalizing them in that way. Also, one of our participants, Danielle, has mentioned young single parents who are also in the category of essential workers who are facing a particular impact at this time. From our panelists, do we have any response to the groups that maybe we're not considering right now?
I think the only other thing that maybe I would lift up sort of in complementary is to think a little bit about sort of, I don't know if you would call it a post-secondary, post-structural sort of response, but populations that, for example, are likely to be abused, maybe not directly about COVID, but as we are all directing intention, much needed resources to that, what's happening in the background. So for me, I think that what comes to the forefront is the fight around DACA, the Deferred Action for Childhood Arrivals. And really, I think it is integrated into a conversation about how we value education or don't, both federally and at the state level. So our state legislature, as many of you know, is still going to pass a budget within the next 2 weeks here, and they are still likely to do many of the what some of us would call immoral behaviors in those budgeting processes, and exclude members of our communities from access to higher education. We're also waiting for the Supreme Court decision, not just on DACA, but on a multitude of other cases. And so I'm thinking, I don't want to be so short-sighted, if not in a rude way, but I don't want to limit ourselves in these conversations from thinking about how this is going to impact communities in other ways as we respond to COVID, which is the urgent, most pressing needs. There are still other things, and those other systems that we're fighting, those are still happening. So how do we sort of not fall into the pattern of sort of putting everything on hold when the systems of oppression are not putting them on hold as well?
I think that raises a really good question about, you know, what we're trying to do here in this conversation and others, as well as the comments about thinking about language and being very intentional about thinking of what we're communicating. I think what it gets down to is this idea about knowledge, how we produce it, but also where we're looking to in terms of what people know. And if there's anything that, you know, has been characterized about our region, it's been this idea about stubbornness and maybe territorialness, which creates these gaps in our knowledge. And so for the panelists as well as the listeners, you know, what are still our stubborn gaps in our knowledge when we think about healthcare structures, labor rights, even just looking at a higher level of systems of racism and inequity? What are some gaps in knowledge that you're trying to tear down and sort of build a new language or a new opportunity for advocacy?
I chime in just a bit and say, at least in the ACLU realm, I mentioned earlier, there is this sense of urgency of getting folks out of jails. And there's always been a struggle with, you know, mass incarceration and the issues with cash bail. And so even after this moment of pandemic and urgency, it's really important that we continue with that momentum that has built in this time to get people out of jails, get people out of detention centers. I would say too, touching back on some of the financial solidarity work that has been happening, there are some systems in place that aren't working for people when it comes to resources that are necessary. I've worked in the nonprofit world for a while. A lot of our work is based on funding and grants, and that keeps us from being able to help people in the way that we should. And it puts a heavy burden on everyone. And I know that there have even been conversations from grantors and funders in this moment, rethinking some of their structures and how they give out money to organizations.
I'll maybe build off that a little bit. I think particularly in healthcare, rethinking how we talk about racial disparities. I've been watching discourse among providers in medical journals, sort of searching for biological or genetic reasons within the last couple of days about why COVID health disparities might exist, particularly for these elevated rates of infection for African Americans. And I think it's another important opportunity to point out that this is not fundamentally a biological problem, right, but a reflection of deeply unequal social structures in our society. And so in terms of missing information, you know, we have a healthcare system, you know, to Alicia's point, that likes to fund research on biological determinants of health and genetic determinants of health, right? And it's an opportunity to push for more research, not looking at these biological factors, but rather the social structures. How is living in a racist society directly connected to health outcomes? And I think it's knowledge we don't fully have, and it kind of connects to Mary's question about birth outcomes, right? St. Louis City has some of the highest low birth weight rates in the state of Missouri, along with the boot heel. And this is an area, particularly with low birth weight births, we don't have full knowledge of. Right? Why is it that African American women experience this? Why is it that wealthy African American women still experience this? And so I think this intersects with a lot of these unanswered questions around race and health for me that I think are really important to address.
On that note, Kylie, I believe you have a question from Mary Angelica.
Yes, Mary Painter shared, I'm especially concerned with the health and well-being of pregnant new African-American mothers, especially since maternal mortality is much higher for these persons. Are there any community work being done to support pregnant African-American mothers? Netta Morrow from our participants shared the JAMA Birth Village. I also wanted to highlight the partnership work of Flourish, which is focused on ending disparities in infant mortality. And if any other panelists would like to respond to that. We can also go to another question that came through from Sal Valdez. And I think we did touch on this, but any further comments to add on ethnic and immigrant communities' language needs and the missing from public health and healthcare data and research?
Yeah, I think particularly I was struck with Sal's emphasis on the absence of data and research available in multiple languages, so that the community itself could engage with the data and research being collected in real time. Does anyone have any thoughts on that, or any viewpoints on how that might be changing or being considered? Chris Prenner, do you have any insights there?
Not directly. In terms of the region, I'll just say that this is a long-standing problem, right? In the United States, the problem, and it's a problem that we correct on a very slow timeline, and I think this is true of a lot of our social systems, where we do have solutions to questions like how do we communicate with folks for whom English isn't their first language, or who have trouble reading. I do work on literacy. And health outcomes, our solutions take a long time to create, and we don't have an infrastructure for sort of rapidly, in many parts of the US anyway, rapidly producing information in English is difficult enough, let alone getting that communicated and translated in other languages. This is something we struggle with all the time, and I think we're seeing this exacerbated by our current public health situation.
I think if I could also respond too, with I think what is being raised, and again, I think this is something that has been voiced before through advocates who speak for immigrant and work with immigrant and migrant communities, is just the ethics about what we're doing with the data. For a long time, many communities of color have been exploited by collecting data that in the end have been turned against and used against them in terms of violent ways. And so I think it also raises this question of, when we gather data, what are we using it for? Are we using it to build sort of more resilient social structures, and who are we sharing that with in terms of how those communities are being punished or being held accountable? I think related to immigrants and migrants in our region, I think a continuing struggle is to push back against this idea that it's just this sort of monolithic population with monolithic needs and priorities. There's a lot of diversity of identities out there. Just making the distinction between the legal challenges of undocumented immigrants versus those who are seeking asylum. as well as how that asylum seeking process is distinguished between other channels of migration, is something that continues to befuddle a lot of our mainstream institutions that are welcoming of new Americans. Many of them don't necessarily know their own treasure trove of resources that they can actually say, yeah, we can actually serve undocumented immigrants, and for them to just be reminded that they don't always have to push them to Casa de Salud, or they don't have to push them to immigrant focused communities. They actually have the resources to deal with these populations themselves. And I think there's this assumption that, you know, that there are organizations around our region that only work with immigrants. And I think, going back to Dr. Sullivan's point, I was really struck by this idea that, you know, the marginalized should only help the marginalized. And that's sort of this norm that I think we've all been trying to work against, because in many ways, it's this sort of linked state between dominant groups and the intersectionally marginalized that needs to be strengthened.
I just wanted to add something. Go ahead.
So there have been groups like Casa de Salud, STL Juntos. I know the ISPN, the Immigrant Service Provider Network through IFCLA. They've done a wonderful job of translating, interpreting, creating a pipeline for language access. But one thing that has been frustrating, as well as like working through this solid financial solidarity line and trying to help folks navigate those, it puts a major burden on a lot of organizations who are already like at capacity right now. We are stretched thin, and now we're getting calls or texts from elected officials asking us to interpret or translate things. I know for myself, I can just say it's been a frustrating experience, and I'd like to see city and county officials step up and start taking on some of that work and being really intentional in doing that, so it doesn't fall on people who are already overwhelmed in this moment.
That's a great point. Sheila, did you also have something to add to this?
I was just going to add, from a practical standpoint, from my history and working with the city health department, when we get cases into the health department that have been reported, especially in a real-time situation like this, the priority is to count the cases and worry about getting the data or the rest of the information later. Is it the right practice? No, it's not. But in the practical real-time situation, we're more concerned with the aggregate numbers that are coming in as opposed to getting more detail. So I believe, just like Dr. Predner said, the details will come. The information that we have that is lacked in African Americans showing up in our numbers in disproportionate rates, I think it's going to be even greater when we get all of the facts in line. But I think it's also going to be representative of many other communities we never really even considered that are being impacted by this. But when we think about numbers and how they're coming in, the aggregate is the most important thing that we need to know right now, and then the rest of it will come later. But we don't need to forget about those populations that are disproportionately impacted, and we're just not talking about it right now.
So, I'm sorry.
If it's okay, if I can add something quickly, Bernia.
Yeah, of course.
Just to add on the city's sort of priority with aggregate numbers, I wish we were in a position where we could sort of walk and chew gum at the same time there, that we had the capacity to do both of those things. And I think that's, you know, I want to see us have a conversation at some point not when we return to normal, but when we have the space to reimagine our public health system, to have the capacity to do both of those things. I understand the sort of very practical need to get those aggregate data, but we're missing out on a lot of opportunity to gain really important insight right now. I also, to Adriano's point earlier about race data and how it potentially is used, I worry about the misinterpretation of these elevated rates for African Americans, and it underscoring for a lot of people that there's something going on among Black people in the United States that makes them susceptible, that they are choosing to do. We saw this with the Surgeon General sort of lecturing people on don't drink and do drugs, like make healthy decisions, and that's what'll keep you safe, which is just fundamentally unhelpful advice, right, in the current context. But I feel like it's important to highlight the racial disparities that we're seeing, but also do it in a way that conveys the complexity of this. And it's not always being done in our local media or nationally. And it's a worry I have that this just becomes another way to marginalize communities that are already marginalized because we're not doing a good job communicating that.
Sorry, thank you. People aged 17 to 24 are largely left out of the CARES Act, the largest federal response to date. This group of people are often uninsured or underinsured. They are regularly working in service jobs, thus highly mobile, even under social distancing measures. How might their lack of economic supports, coupled with a lack of access to healthcare, endanger our broader community level recovery?
Happy to try to start to take a stab at that. Yeah, I mean, I think that, as I mentioned before, we are going to have a whole group of young people who are sort of denied the access to some of the traditional mile markers of transitioning from childhood to adulthood, right? Obviously high school graduations, college graduations, potentially even college entrance or entrance into training programs or apprenticeships is going to be temporarily or maybe permanently suspended for some of these young people. I know that being able to afford college already has been challenging, and we now have a group of young people who have some credit towards a college degree and may decide it's in their best interest not to return to campus or not to return to their studies this fall. And what does that mean for them completing and really being able to enter into a field that they were pursuing? Those fields may not still even be in existence on the other side of this too. So I think there is going to need to be very quickly some dissemination of information about how the work world is changing, both for folks who have held jobs for many years, as well as for these young people who are entering the work world. Obviously, all of the gaps we've talked about in access to healthcare, access to housing, access to other basic needs is exacerbated for this group. And certainly the lack of being able to be in community with other folks who may provide sort of that mentoring or that wisdom. We've all maybe had a boss or an older person to us who has mentored us in some way and helped us navigate the world as we have transitioned ourselves. And I think with this forced distancing, we're missing out, and young people especially are missing out on those opportunities to learn from and help navigate the world from adults who have maybe a few years or maybe many years on them. So I'll stop there.
Thanks, Katie. Chris Sullivan, do you have any insights about this age group, which I'm sure is quite prevalent on campus, 17 to 24-year-olds, and how this might be impacting them?
Yeah, I mean, I think we've seen just in these last couple of weeks with it on campus. So I serve also on kind of our care team, which is our students identified that are have concerns that are presenting. Primarily, we have just had this increase in just food insecurity. This is a problem across university campuses across the country. So much more food insecurity, so much more economic, financial insecurity, housing difficulties, things like this. So yeah, I mean, this is just becoming more and more apparent. How thin I think some of the resources that people have been balancing on, that it was really living paycheck to paycheck with it, and just as a society, how this is just not a tenable situation. We cannot have and live in this society where so many people are just balancing on the edge of this with it. So, I think that, again, coming back to this whole idea about people were, we have students that are pursuing an education to make improvements to their lives, and recognizing it's just a thin line between, what resources people have available to them and how moving forward with that. So these fault lines are not faults anymore. They're giant chasms that have been as we're kind of moving forward.
Thank you. Yeah, good point.
So maybe if we could think about this in a different way, and think about in the context of children and K through 12 schools. They're fundamentally different now, and we're all sort of dealing with this idea of a new normal. There's a lot of discourse out there in terms of what this is going to look like eventually, a couple months down the line. How are schools going to deal with the aftermath? And what does that look like? I also want to sort of bring in other groups that this panel is also working with in terms of how disabled or differently abled communities, as well as the migrant and immigrant communities, what does that new normal look like for them? Is it actually a new normal? Is it sort of just the same?
I would maybe just add or sort of share one of the individuals that we work with through the accompaniment program shared with us sort of this question about how am I supposed to help my kids who go to public school when I don't speak the language well enough or read the language well enough to understand, let alone navigate technology that I'm not familiar with. And I think while sort of my perspective or area of expertise would lend that to or suggest to me that that's sort of an exacerbated reality, I think it would also be copied in other realities that are not just language barriers, but other barriers to sort of household education. And so I certainly am not the expert here on the panel, but I just want to bring that up too, because it's something that really struck me, hearing friends and moms that are trying to deal with how to educate their kids at home and relearning how to do math as a second grader, which I don't know how to do. So I think, like, man, how can we blow our own minds so that we can still sort of try to understand this bigger picture of impacts that are maybe not right in front of us. That's not really an answer, but I just wanted to add that to the conversation.
That's an answer. I like the answer.
Yeah, I mean, I have a lot of concerns about obviously students who have identified disabilities, whether that's physical or learning associated. Traditionally we talk about IEPs and 504 plans that are often challenging for schools to fully accommodate into the school day, and now we've asked parents who may still be trying to work from home or are going out to jobs that are essential, or really just trying to maintain their own mental health right now, to be doing the academic pieces as well as potentially the therapeutic supports that children would be receiving in schools. I mean, there's certainly a lot of concerns there. I think it's been amazing, the ability of our region's behavioral health service providers to kind of ramp up quickly some telehealth services. I heard today that it's not just one-on-one counseling that's happening, but counseling groups or therapy groups that can continue to happen through these sorts of teleconference technologies. And so that's hugely helpful. I also think about children whose homes are not the safe places for them. We know, unfortunately, that the reports of abuse and neglect are way down in Missouri right now, because educators are typically our primary mandated reporters. And so concerns certainly about young people who may be in home situations where they don't feel safe, where they don't have the supports that they need, and yet are being expected to stay inside those four walls. So just, again, another group. And I think fortunately we are starting to think about how do we support educators and other folks who are providing these sort of teleconnections to be able to spot abuse through, a computer screen. But we've obviously got a ways to go on that.
This is Kylie. I want to thank everybody for many of the comments and the questions coming in. We might not be able to get to all of them, but I want to highlight one. Actually a couple. We had one commenter, Wally Seward, say he's curious about the impact of small business closures, which we're going to see a huge wave of in fiscal year 2020, and how that will be impacting communities of color. Entrepreneurship is hard enough already in under-resourced communities. 100% agree. We were hoping to have Cordelia Patrick from the St. Louis Economic Development Partnership join us today to speak a little bit more to the impact on businesses and small businesses and communities of color, but we'll be certain to share further resources in the follow-up on that. Great point, and I'm glad you made it. Thanks, Wally. Also, a shout out to make sure that we let folks know that there's need for blood donations right now. And so if you're able to do so, do so. And a comment from Craig Schmid regarding public health data, and also wanting to make sure that we're trying to engage our private providers, our hospitals and other service providers in sharing that data, because we know that there's a lot of data that can be useful to our region as a whole when we come together in that way. So then I've got one more question that I think might be able to kind of round things out here. The COVID-19 pandemic seems to have increased people's awareness of our interconnectedness as a St. Louis region. How can nonprofit groups and service providers use this increased awareness to invite individuals, businesses, and government leaders to be positive change makers and support marginalized communities? So if anyone would like to respond and to share that, and same to our audience, if you'd like to chat in ideas via the chat. We are recording this and wanting to make sure that we gather everybody's input that we can.
So thank you. Thanks, Kylie. I appreciate it. And thanks, guys, participants and everyone listening for continuing to share comments and questions. We're going to try to bring as many voices into this as possible. In response to the comment on economics, I'm going to ask a question around the economic response. The pandemic response is requiring a lot of economic resources on very short notice from a large number of societal actors, institutions, nonprofits, local governments, small businesses. Where are these institutions getting the resources that they need to respond on such short notice? And how might this ability, it seems like folks are figuring it out to respond right now, but how might this affect their ability, these institutions, these societal actors, to continue to keep up their basic services after this storm has passed, or maybe as we are a little further along in this storm, depending on how long it takes. Does anyone have any insights on how our societal actors are figuring this out to respond to something nobody really, that is fast moving?
I would maybe respond honestly about how, to the question of like where are the funds coming from and how are nonprofits trying to like do this. I would say in my situation, as a really small nonprofit, there's been a lot of cussing and a lot of tears and a lot of pretty pleases. I think, sort of like within that context, right, part of what has been realized or exposed through the interconnectedness, through the highlight of sort of, as many of us have talked about, sort of pre-existing conditions in the sense of our community dysfunction, I might say. I think what has also been highlighted is there is still perhaps an opportunity for folks to have the blinders removed and be able to see that they are also or can also be connected. And so I think that in some ways we've seen that in like direct giving, and maybe certainly Alicia, you could speak to that from a community space. I think from an organizational space, seeing individuals who got the stimulus check unexpectedly, for example, and are figuring out, well, where can I just give this, right? Or where, what are the individual ways that as actors in this huge system that I maybe can't, I certainly don't have power to like address at this level. Well, what can I do differently in my own life? And if that for some people means throwing money, extra money that they had into a problem that they didn't before, like bring it on. And if that means showing up to volunteer or to organize in ways that they didn't before, then like bring that in. And I think part of how my organization is trying to see this is, and I think there was a question about it, about reimagination, right? Of like, how can we reimagine what accompaniment looks like, what solidarity looks like, and in some ways what fighting systemic oppression looks like when we are in totally new spaces. So
Yeah, I would just say, sort of as an organizer, one thing that's been challenging is that I know a lot of our organizations focus on sort of putting impacted people at the front as far as our campaigns, our work. And so right now, a lot of people are dealing with what is happening. We don't have time, like we have limited resources. We're worried about money. And so as an organizer who's someone who tries to like work in community and motivate people, and it's a very interpersonal role, it's been really challenging sort of shifting from that and trying to organize and build, but also taking care of people's immediate needs, which is why I wanted to get involved with the financial solidarity work. Because to Sarah's point, like, I feel personally that this is a new way of giving and a new way of being in community with each other. And it's structures that have existed in different cultures long before us. And it is able to sort of alleviate some of those structures, those systems that kind of keep restrictions in place when it comes to charity work or that type of mutual aid work. Yeah.
I think this is a really powerful moment we have before us right now. I don't think that any of us can pretend like this is not something that can possibly transform our society. I mean, we've gone through years of change in the last couple of weeks, right? I mean, just even as we're talking about this, and even the question of is there a public health consequence for an individual not having health care? Could that be any more obvious right now? So, I am hopeful that we'll have this fierce obligation, I think, to emerge from this, that we need to take care of each other, because taking care of other people is also the best way that we can take care of ourselves. So it's this kind of enlightened self-interest, I guess, with it. So I'm really hopeful that as we can continue to have these conversations and look at this, that, this sense of looking out for each other is the best way to look around and take care of ourselves and the people that are closest and nearest and dearest to us. So I guess I'm kind of a professional optimist with it in that respect with it, but I'm really hopeful that this can really promote some dramatic changes with it, because there's no way that we can pretend any longer that what happens to my neighbor or the person that lives down the street or across town doesn't have an impact on me directly. So that's just my aspiration, I guess, for what this is all going to come to.
Thanks, Chris. I appreciate that. Yeah.
One thing that I've noticed from these discussions, as well as other circles that I'm part of, is no matter what the issue is, immigration, education, many people have observed these silos that exist in our area, and I think they're supported by a stubbornness to work with one another, but also maybe it's out of fear of territoriality. Maybe it's self-preservation. But to your point, it just seems like this is a moment of opportunity to collaborate more and to really question what we're really doing. And so, you know, in the minutes that we have left, you know, as a practitioner, as a researcher, as an advocate, you know, how do we make sure to keep this momentum going, to make sure that this opportunity that we're observing isn't just an opportunity, that we're actually taking steps to institute some of this more collaborative sharing of resources?
I mean, I know it seems like a little thing, but I've certainly been pulled into the conversation about Wi-Fi as a public utility and, frankly, a necessary utility for our community going forward. You know, if this is going to be a way that individuals can access education or physical health or behavioral health or other services, it absolutely has to be much more widely available and powerful. It obviously currently is highlighting our class divide, but it doesn't have to be that way.
Other thoughts about in some of the other issue areas, medical, public health, education?
At least in terms of public health, I certainly feel like our geographic divide works against us here. So this, you can see from mapping cases in the city and the county, they don't stop. There's sort of no division between North City and North County, but all of our public health infrastructure, right, ends very abruptly. And while the city and the county have had similar approaches, they've not always been in lockstep either. And so for me anyway, I think this has highlighted the importance of a regional approach to public health and thinking about how we can move away from, you know, the culture of the Great Divorce here.
So we are about to move into the question and answer portion of the conversation. I do just have one more prepared question before we do that, but we have seen a number of protests around the nation and here locally. Does anyone have any ideas about how we might need to think about the appropriate form of protest? How do we respond or make clear desires for systems level change, take direct civic action in our new environment?
So I would maybe, I think I'm instantly flooded with like pictures that I would use language like horrific to describe in other states. But I'm also drawn to like social media feeds of colleagues in Missouri that that did a really great, cool, reimagined, there's a bunch of different adjectives, form of protest yesterday across I-70. Elisa, is that something that maybe I was sort of only remotely involved in? Could you speak to that a little further or no?
Yeah, just a little bit. I'm also kind of remotely involved. So Kansas City KC tenants have been leading a campaign, hashtag Protect Mo Tenants. They've been doing a lot of housing work, but they've been focusing on rent moratoriums or rent eviction moratoriums and halting rent. And so, yeah, they had a protest, practiced social distancing, made sure that they protected the health and wellness of people. And it was an opportunity to involve everyone across the state, which was really cool. We don't often see that. And so as Sarah mentioned, it was across I-70.
I think thanks, Alicia, because I think what again, we've been forced into is not just in the way I think about accompaniment or solidarity, but practicing, you know, disrupting those systems, that has to look differently. Even something like, so our organization is also deeply involved with sanctuary work and the National Sanctuary Collective. And through that, we had, days of action in DC with dozens of meetings set up with members of Congress. And then it was like, well, that's not happening, but Congress is still happening and legislators still legislating. So how do we have access to that? And to my surprise, I guess I would say, many of those offices are willing to have video calls, have conference calls. And I would also say when they don't, that's an opportunity that we sort of, as the electorate or as residents of these states and districts, we get to say, well, how come we don't have access to our elected officials? And so I think it is shaping again, like, how do we engage? How do we totally get creative about protesting? I don't think I would have thought about parking cars along Highway 70 at strategic exits as some like mass demonstration, because we usually take cars out of mass demonstrations, right? We try to do really intimate and close and get people together in a tight, and so like it's causing us to rethink that. And I think that is both exciting and daunting and bigger than me.
If anybody has any information, any more information or direct information beyond Alicia and Sarah on protect mode tenants, and but broadly on any of these appropriate, safe, practicing social distances, ways to engage civically, to act directly, we would love to have that added to the chat, to our Q&A, and if possible shared with other organizations and folks who are looking to implement and think about ways that we can both be safe and be heard. So now we're going to move on to Q&A. In addition to, I would like for you to continue to add those questions into the Q&A. Our moderators will be looking at those closely. Many of you guys sent in questions through registration. And so I'm going to ask a couple of those. We'll sort of pepper them throughout. But the first one I'd like to ask is, how do we seize this opportunity to dismantle structural racism in St. Louis? This was a question that was submitted in the registration page. We can take a slice of the elephant if we can't chew the whole thing.
I mean, like every way possible, right? How do you do that? In every single way that you can imagine it.
I think by consciously making the decision that we're ready to end it, it's not going to happen until we make that decision that we're going to change. We keep getting reminded this thing keeps coming back over and over again. And until we address it, it's never going to go away. It's just going to keep getting bigger.
Yeah, thank you for that. It does keep coming back over and over again. And so, my grandmother used to say, if you keep hitting your head, you need to figure out how to duck, right? Like if you keep coming up to the same problem, that means you've got to fix it, right? So the other one that is pretty close, but it asks specifically about health disparities. So how do we as a region improve the our approach to solving health disparities in a more coordinated fashion? And Adriano, you also brought up this idea of silos. What are some ways that we can poke through those? What are some concrete tactical ways that anybody might have observed or be sort of chewing on or thinking about that we might be able to poke through some of these silos?
I was just going to say that it's going to take leadership. Leaders have to be cognizant of the need to include the voices that are not being heard. And they're going to have to step aside and start letting those voices be heard. Until the leadership starts to change, we're not going to see any changes here.
I also appreciate Abby's comment in the chat. I think it's relevant here is that one way to break down the silos is really centering, prioritizing the voices of the impacted communities. And not only just think of that as communities that are only there for research purposes, but actually partners in producing knowledge and producing action. and not necessarily just view them as survey respondents or participants in experiments. I mean, coming from an academic researcher, I think one way to break down those silos is actually start from the impacted communities, let them sort of define the problems themselves and decide what should happen with the data in the first place.
I'd like to add to that too. A lot of folks know we do a lot of this work in coalition. And to Adriano's point, oftentimes there are experts, organizational leaders at the tables. When we do bring people from impacted communities, oftentimes this is not their day job. They are doing something else. And then we are asking them to come to this table and provide their knowledge and experience. And I think we need to find ways to be able to support people and build leadership pipelines for them. Like I know Action St. Louis has their BOSS program, which is the Black Organizing Summer School. So we definitely need more programs like that.
Yeah, thanks for that, Alicia. Yeah, building the leadership pipeline, that's awesome. I wonder if anyone is aware of, one question that was submitted in the registration is, what accountability measures are in place to ensure that federal resources are allocated equitably? If those measures aren't there formally or solidified by power structures, are we aware of any organizations that are particularly focused on making sure that resources are allocated equitably?
I think in some ways I would actually suggest that it is not an intent to have resources allocated equitably. I think in some ways we are seeing intentionally resource allocation to further what was attempted to be constructed from the beginning. And so speaking specifically as it relates to immigrants and mixed status families and undocumented populations, you are seeing that furthered in the way this happened. It's not by accident that we forgot to include or enable folks who have ITIN numbers to be able to be eligible. That is 100% intentional. And so I think there's a space of like, oh, let's like fight for equity and resource. Equity didn't exist in resource distribution in the beginning. And so in some ways, I wouldn't expect to see it here. And I think we need to like be really in tune to seeing the ways that it is intentionally not done equitably to further and sort of uncover those existing plans.
Thank you, Sarah. Thank you for that. Yeah.
I also wonder if this is an opportunity to expose some of the false accountabilities too that have been baked into the system. You know, specifically thinking about K-12 space. Missouri very quickly suspended testing this spring. You know, that was that decision to not do those, you know, high stakes tests happened before we even decided not to return to school buildings this, you know, academic year. And so sort of flips the conversation of, you know, what do we really need to be accountable to students from the federal level, from the state level, and locally too.
Yeah, I found myself to be struck by the idea that in some ways this is exposing a lot of what is possible. A lot of the things that we were told were pretty impossible and could never happen and the world would end, we are now seeing happen. And it is sort of broadening the sociological imagination a little bit for a lot of people. And we're sort of being able to see what's possible. So yeah, that's fair.
I think to that, Desiree, if I could just add, it's also exposing the power within these systems and who has it and who doesn't. So as much as it's exposing the opportunity, it's exposing what we're going to have to overcome in order to get there. And I think to the previous question of like, what do we do with this? How do we dismantle systemic oppression or racism in this time? I think is we have to start to look at power and who holds it and who doesn't, and how is that controlled, so that as all of these different communities, all these just different reactions, like if we're not also assessing the power behind that, then I think we're missing a big step forward.
And I think Sarah's point's really well taken, particularly with the last question about health disparities. That if we really want to address health disparities, it's less talking about health insurance and our healthcare system necessarily, and more talking about addressing these power inequities and addressing systematic racism. I mean, these are the fundamental reasons why health disparities exist, and not focusing our attention on, while expanding Medicaid is really important, right? Access to healthcare is only part of the battle here.
Thank you for that. So in addition to some of these questions, we got some really kind of concrete, straightforward questions, especially from the registration. So, and I think this might particularly be, if Sheila or Chris could maybe answer some of these. Do we know if rapid test is indeed available in St. Louis City?
I don't have a definite answer on that one.
Okay.
Yeah, and I don't either. Again, this continues to be just really complicated. It's being managed by the county, it's being managed by the state, it's being managed by individual providers. Testing is a mess. Don't let anyone let you tell anything else. It's a mess.
Absolutely. Okay. And how might we be able to monitor or know the percentage of St. Louis City that has been tested? What's the reliable resource for that?
Again, I'm going to say that it's not coordinated. I mean, we have these parallel structures. We have the state that was initially responsible for testing, and the state was then confirming their results with the CDC. So those took forever to get taken care of. I'm talking about ages and ages ago, like a month. So those took forever, and then we started getting private labs involved, and now we've got individual providers that are doing some of these. We've got the the drive-through clinics and stuff. We just don't, and some of those are being screened yet. So before you can even have access to the test, we are nowhere in the realm of having on-demand testing available, and that's the only way we're ever going to know what the actual kind of state of our this of COVID-19 in the population is with it. So it's a big problem.
Yeah, thanks.
I was just going to add that the way that the system is set up, the city health department or the county health department should be our local touch point when it comes to reporting. They report to the state, who in turn reports to the CDC. When we first had the testing, the test kits were coming from the state health department, and then they were being reported directly back to the state health department. I think that was their way of trying to keep control of the numbers to see where they were, but realizing as this pandemic continued that they needed to amp up the testing. So when you introduce private labs and you introduce physicians, their priority is not to report. Their priority is to test. So they're getting those results back to the individuals, but they're not necessarily reporting. So just like Chris said, we don't have any idea of what's out there. We have no idea. And the fact that we are not testing at the rate that we really need to in order to be able to see what's really here in our population should be very scary for people, because I think we're not even seeing the breadth of what's really here. We're just seeing those people who have been extremely sick and those who have been persistent enough to get a test. So opening up Missouri, I think, is a bad idea right now.
I will say on this point, and then I'll hand it to Desiree, one source that has been really great in trying to track what is going on is the St. Louis American and reporter Rebecca Rivas, who has been really helpful with this first conversation. But going forward, I'm going to put her Twitter handle and then also her name, so that it is a mess. And I think it just reemphasizes the importance of journalists, as well as like journalists of color, who are covering this to give us any sort of credible information. Desiree?
Yeah, thanks. So I want to encourage everyone, panelists and participants alike, to continue using chat and the Q&A to provide resources, to provide comments and observations. We're going to try our best to compile this in a digestible format and send that out to everybody involved so that we can continue to grow and learn together. But with that being said, by way of sort of closing out the conversation, I'd like to give our panelists an opportunity to think about closing, to sort of provide us with some closing thoughts. I really would love to hear from you guys, the panelists. What will sort of be your next steps as you leave this conversation? What do you, your organization, or your constituents need from allies or people who hope to be allies right now? And then what's a big question that our region might need to answer if we're going to make it out of this storm sort of healthy and whole or stronger? So as you guys sort of think about ways that we might be able to wrap this up, I again want to encourage panelists and participants to continue to leave things in the chat, as well as to continue to conversate with us as we think about the next steps, and there will be more conversations going forward. So if we'd like to go ahead and start with closing statements, would you like to start, Dr. Grigsby?
Sure. We've covered a lot of information today. We've talked about a lot of topics. And I think one of the things that keeps coming back when I'm listening to this conversation is we've talked these things, but what are we going to do after we get off of here? What are we going to do to make a difference? And I think that's an individual question for each of us. I know that sitting here in solitude for the last 5 weeks and trying to decide, okay, how is this pandemic going to make me a better person? I have to make the conscious decision, as all of us do, that we're going to make that decision to treat each other better, that we are going to be more mindful of who we are interacting with. This has brought to mind so many different disparities, so many different inequities that we often just forget about in our common conversation. And if nothing else, I'm hoping that people walk away from this experience knowing that, there's this saying that says we're all in this boat together. Yes, we are going through this pandemic together, but our boats are all very different. And we have to be mindful of those different boats and how we are going to consciously do a better job. In regards to the College of Nursing at UMSL, we're always looking for ways that we can serve. When this pandemic hit, our nursing students were out of clinical hours, so they need those clinical hours to graduate. So if there are experiences or opportunities that our nursing students can do in service, we want to hear about those things so that we can partner with you to help make this community a better place. Again, I want to thank you for inviting me to be a part of this panel, and I look forward to working with you in the future.
Our pleasure, our pleasure. Alicia.
Yeah, I would say a question our region needs to answer is one that we've not figured out. A lot of us who are on this call and on the panel have been working in a lot of these spaces for a while, and we've been well aware of a lot of disparities and injustices that exist. And now it's sort of being amplified as things just are kind of falling apart because these systems and structures aren't working. So I would say one thing I'm trying to figure out for myself is how to continue this work even after the pandemic, because even after the pandemic, it's not going to be the same. People are still going to deal with some really awful hardships that they were dealing with before, quite frankly. And so continued coalition work. I'd say also, I was speaking to an organizer in Columbia, Missouri. There's always been this need and want to connect us statewide, not just regional. What is happening in rural Missouri? How are communities being affected there? And trying to build sort of a bridge between St. Louis and KC and bringing everyone in Missouri along with us.
Really appreciate that. Sarah.
Thanks. So at light of sounding sort of like everything's great, which is not the perspective I want to communicate, I do want to end with some gratitude about the impacts and the strengths and the outcomes of really hard work over the last several years, right? I know specifically, Alicia mentioned the Missouri Immigration Policy Coalition. We have relationships now, certainly supported by that coalition, facilitated through the ICE rapid response teams and all the, we know each other better now than we did 5 years ago. and we are more connected now than we did then. And so if I get a call and I don't know how to respond to that, I have at least 5 people that I can call and say, I don't know what to do with this. And it is not the solution, but it is progress, and it is heading in the right direction. That our commitment to keep building those relationships, to keep sort of being willing to F it up and then try again, and then like keep going through every single wave of hatred that comes to our communities, we figure out how to come out stronger. And so I think that's something that I want to cling to personally and as an organization, to figure out what to go forward and what is needed to go forward. I think somewhat is more of that, and a renewed commitment to figure out what relationships need to be strengthened, figure out where we still haven't built them. It's exciting to me to be on a panel and included in conversations with organizations that I haven't had an opportunity to see. I think while analytically we often talk about, upstream forces being the same oppressor, we're still in different streams. And I still don't even know your boat, and I don't even see your boat. And that's a fundamental problem if we're going to try to make systemic level change. And so I think my commitment and my hope and my challenge, I guess, is to figure out, sort of get out of our boat a little bit and see, we can beat this metaphor, Dad, if you want, but I like to figure out where else, how much wider we need to open our eyes and be willing to do so. Thank you.
Thank you. Katie?
Yeah, I think in a similar sort of vein as Alicia, I think this idea of not trying to return to normal too quickly, and this need, I think, especially for a lot of comfortable white folks to really lean into the discomfort that this has, elevated into our lives. I think obviously it's been touched on that most of the challenges that our folks are experiencing right now are more about being exacerbated than new challenges to communities of color and folks who are economically disadvantaged. So I think that would be sort of the longer term learning for me, and certainly a hope to continue to work with new partners, and that the importance of really trusting relationship in all of this too. Certainly have seen how the establishment of relationships has really, moved things forward more quickly, and the importance of those trusting relationships even in the face of a crisis and folks trying to move really quickly. It's just, again, a nice highlight of all the good practices that we hopefully are have as part of our core values anyway, and a highlight on all of the failings and the things that we haven't yet addressed that we need to.
In our last minute, sorry for the time pressure, Chris, we'll have the two Chris's. Chris Printer, if you want to go first, and then right after you can follow up, Chris Sullivan.
Sure, I'll be quick. Some of the work I've been doing the last couple of years at SLU involves helping community organizations build data analysis skills, particularly with free software. And I think there's tremendous power in being able to not sort of wait and rely on official statistics, but be able to leverage that for people's own organizations. And I think we're seeing some of the holes that exist in our current data sharing systems. And so I think, at least for me personally, I think there's tremendous need and opportunity there in the St. Louis region. And I'm excited to getting back to doing that work once we're able to do things in person again.
Thanks, Chris.
Okay, yeah, and I have a great deal of gratitude for being involved in this, and I think what I'm going to be moving forward with this is, I think, trying to connect with some of the, these aspirations that I have, with the recognition that, from my own privilege with it, I need to kind of see what those other votes are with it, and to kind of consider, we're very careful, I think, and sensitive to the kind of the services we're delivering at the university and how the university plays a role in the community with it. But we can't just kind of keep doing what we've got, because we're not going to come back from this and not be changed. It wouldn't be right with it. So I think personally, I'm going to be looking at this as what impact can I have in my institution, in my unit, and then just also personally as well, what we can do to do this differently and do this better, to create a culture of care, I think, across and include all people in this.
Great. Well, we're at time. I just quickly wanted to say thank you to this panel for, I know everyone's beyond capacity and everyone's running on fumes, but that just makes me even more grateful for you taking the time to be here, as well as to start hopefully more conversations with practitioners, with academics, with impacted communities. And so thank you so much. Thank you for the attendees who hung out with us through this entire time. This has been being recorded, so we will share this shortly. In follow-up emails, you should get a recording, but also you should also, people will also get a Google form, because we want to, again, hear from you in terms of those questions that Desiree asked this panel, in terms of how do you go forward from here? What are sort of your next steps in aiming for a lot of the things that we've talked about? And so we encourage you to share that with other people and also fill that out. And so hopefully we'll be in contact again with another collaborative community conversation. But until then, be safe, and thank you for all you do. Thanks, everyone.
Thank you, guys. Thank everyone. Thanks so much. So Kylie, are we still recording? Can we stop the recording?